Hello and welcome everybody to the Aspect Research Centre for Autism Practice, Autism Friendly Innovations webinar. We'll be talking about practice models for autism friendly work leading to real world initiatives. To start with, I'd like to do an acknowledgement of country that Aspect acknowledges the traditional owners and custodians of the country throughout Australia, recognizing their continuing connection to the land, the sea, the waterways, and community, pay respects to Aboriginal people, their cultures, their elders, past and present, and we welcome any Aboriginal or Torres Strait Islander people with us here today. So as I mentioned, we're talking about autism-friendly work. I am working for 2 days at Gold Coast Airport and really thinking about how to make different experiences that autistic people might have as autism friendly as possible. Over the years, we've developed a framework to help this, and I'm really interested in why we have frameworks and how they might help autistic people have a consistent set of experiences, whether you're in a museum in Sydney or in an airport in Glasgow. Ideally, you should have the same set of experiences and the same set of expectations. We'll hear a little bit about theory from myself and from Ru, and then we'll come into a really interesting set of practices with Aimee. A few introductions. My name is Tom Tutton. I'm the Executive Manager of Aspect Autism Friendly. I manage the work that we do across airports, trains, shops, shopping centres, cultural institutions, and have been at Aspect for 18 years. We'll hear from my colleague, Dr. Ru. Ru is a research fellow at ARCAP, and Ru's research focuses very much on how we can improve the mental health and well-being of autistic people. Currently, Ru is leading a program of work examining self-compassion in autistic adults and the parents of autistic children. My other colleague, Dr. Chris, is also presenting. Chris is an autism researcher with Aspect and an adjunct research fellow with Griffith University as part of their Inclusive Futures Beacon. And finally, we'll hear from Aimee Fletcher. Aimee is an autism researcher at the University of Glasgow. Her PhD is a participatory project that aims to make cultural heritage sector more accessible to neurodivergent people. In addition to her research, Aimee is an experienced advisor and consultant and has worked for a range of different autism charities. Hello, my name is Tom Tutton. I am the Executive Manager of Aspect Autism Friendly. This is nearly my 19th year at Aspect, and I'm looking forward to talking to you a little bit about the model that we use for our autism-friendly work. We have a small team of 11 staff, 9 of whom are autistic, many of whom also have co-occurring conditions like ADHD, medical conditions, and things like that. So we represent a fairly broad base of autistic people. The model that we use in our work is very much one of co-production. So that's one of autistic and non-autistic people designing, delivering, reflecting, improving our work together as an equal partnership. We also use the social model of disability to inform our work, where the majority of what we do is try to remove barriers in the physical and social environment so that autistic people can make the most of their everyday lives. We work across Australia, and we work in a really wide range of different areas. So this includes airports, trains, trams, shops, shopping centres, a whole range of different cultural institutions like zoos and galleries and museums, healthcare settings, so breast screen, emergency. We've done some sport and leisure activities, working with people like Western Sydney Wanderers or Basketball New South Wales. We've done limited amounts of work in education and workplace settings, but also really have an interest in building design. And we operate quite a few autism-friendly events that might be things like a quiet hour or an early birds, but also we support activities like Mardi Gras or Eid festival to be more autism friendly. The majority of our funding comes from organizations paying us to do the work, but we do get government funds and we get some support from Aspect's fundraising team. Our autism friendly framework has evolved from a very small base. We did some work with the Riverside Theatre in Parramatta about 8 years ago. And since then, through consistent practice, reading, research, and reflection, we have improved our model to be, I think, quite comprehensive, to a situation now when we work with people, we don't find that we have gaps in our model. Our framework is very much based on a process of assessment. So we complete what's called a participatory walkthrough, and you can see an example in the picture there. That's Beck and myself doing this walkthrough at Sydney Airport. So the process is an autistic person and non-autistic person walk through an environment together. The autistic person describes the impact of the environment on themselves, the lights, the sounds, the clarity of what's expected, etc., etc. And the non-autistic person writes it down. We also both take photographs, and we use those photographs to help to describe the impact of the environment, what works, what doesn't work on autistic people, with the guys to then developing a really comprehensive report to change environments for the better. Whilst we use the same overarching framework in every presentation, the details within those frameworks are different. So if we're working in an airport, for example, thinking about sensory and thinking about the tactile component of sensory, we might think about school uniforms and the impact that uncomfortable school uniforms might have on somebody. Whereas if we're working in a different setting, like an airport, we might be thinking about the impact of the security screening and being swabbed and touched by another human being. Same category, just it looks different in different environments. What's also really important to us is that we check to make sure that the people we work with have implemented the recommendations. So we do implementation or progress checks, and we are working towards developing an accreditation for environments so they can prove and demonstrate that they are and maintain that autism-friendly approach. Our framework has multiple components. It starts with a culture of inclusion. So we understand that autistic people in many, many situations have been excluded from environments and made to feel like they don't belong there. What we ask of our partner organizations is that they explicitly make autistic people to be welcome. Sometimes that might include having the hidden disability sunflower lanyard available as just one visible sign that environments and staff are welcoming to people with a hidden disability. A key part of our framework is one of preparation and predictability. So this really is around helping autistic people have as much information as they need to be successful in an environment before they go. Typically, this might be a visual story, a sensory map, or some other kinds of resources. This is really the who, what, where, why, and when of an environment, the steps, the processes, expected behaviors, any bits of hidden curriculum. We try and make those available in different formats to meet the needs and preferences of different autistic people. The next component of our framework is called structure and visual organization. And this is really about environments and making sure that when you get to an environment, it's intuitive and easy to navigate. So very clear signage, the environment supports the fact that you know where you are, what you're doing, what the next steps are, with clarity and without confusion. The next component is perhaps the most obvious one, which is about sensory adaptations. What's really important to us is that we try to celebrate the sensory joy that comes with autism as much as acknowledge the sensory challenges. We do try and change environments, reducing lights, reducing noise, reducing busyness and bustle and touch. However, where we are unable to do that, for example, going through security at Sydney Airport, we try to provide sensory information in advance for people. So this is what it's going to look like, feel like, smell like. And with that information, Ideally, people can prepare for those experiences or sometimes try to avoid them if possible. Added to that, we provide information about where the quieter, calmer areas are in our environment. So once people experience something that might be overwhelming or upsetting, they can then find quiet spaces. And this often includes a quiet room. We also promote sensory coping, so headphones, fidget tools and toys, those sorts of things that might help people manage a difficult environment. We do a little bit of work around communication and communication supports. Most of our partners don't get to know the people who come through their environment very often. These are often visitors who might just visit once a year. However, where there are specific language needs and issues, it could be doing a shoe fitting, it might be checking in at an airport, things like that. We do develop communication boards that identify key bits of language. So if somebody who perhaps doesn't speak or at that point can't speak, there is a mechanism to communicate key phrases and messages. We do a lot of staff training, and we appreciate that many of the barriers in the environment, apart from the physical environment, are in the behaviors and attitudes of other people. All of our training is co-developed and co-delivered with autistic staff. The last two elements are very much around improvement. So we know the sorts of things that typically might stress and challenge autistic people: long waiting, unpredictability, uncertainty, change. And we work with our partners to try to avoid those in the first place. But where they might come up is then to continue to make things better. And that falls into this review and improve criteria. So we ask organizations to show us that they keep feedback from disabled people, they listen to the feedback, and they use that feedback to make their environments continually better. It's very difficult to make an environment perfect, but we expect that people do continually improve.
We've just heard Tom introduce the Autism Friendly model being implemented at Aspect. I'll go through some of the other models now. Mary, Sue, and Sebastian developed the Autistic Space model to offer healthcare professionals a simple framework that promotes accessibility without adding to current clinical burdens. The reason for developing this model is that research consistently shows that autistic people experience difficulties accessing healthcare due to healthcare provider communication differences, sensory differences, and systemic factors such as resource and time constraints. And these barriers to accessing healthcare are associated with adverse health outcomes. So SPACE stands for sensory, predictability, acceptance, communication, and empathy. They provide a long list of sensory recommendations targeting various senses from sight to touch. Their recommendations around proprioception and interoception and pain are especially relevant in the healthcare setting. Their recommendations around predictability include providing information to patients ahead of time, creating clear signage, and providing a social story. This framework pushes for autism acceptance, not just autism awareness. For communication, the authors highlighted numerous communication differences experienced by autistic people. And then the final category, empathy, is around educating healthcare professionals on how to recognize empathy in autistic people and also how to empathize with their autistic patients. This recommendation arose due to the double empathy problem. The Aspects with a double S Design Index proposes 7 design principles to improve the built environment for autistic people. Firstly, acoustics helps manage noise using soundproofing in quiet areas. Spatial sequencing means organizing spaces to follow a smooth flow, matching daily routines without causing sensory disruptions. Escape spaces are quiet, calming areas for when sensory overload happens. Compartmentalization breaks large spaces into smaller ones for specific activities to reduce sensory distractions. Transition spaces help ease the move between different activities and sensory environments. Sensory zoning groups areas by the level of stimulation they provide, and finally, safety. This is based on the assumption that some autistic individuals may be at higher risk for injury due to sensory-seeking behaviours, so spaces need to be designed with safety in mind. This guide was used to transform Dublin City University into the world's first autism-friendly university. So on the left side here, you can see this beautifully designed quiet space, and on the right, a sensory pod. The service principles are a set of guidelines developed to help businesses create autism-friendly environments. They stand for sensory, equipment, respectful, visual, intentional, create zones, and environment. For sensory, they suggest creating environments with comfortable sensory stimuli like light, sound, and smell to prevent overload. For equipment, they recommend using furnishings that help reduce noise and create clear, organized spaces. For respectful, they advise greeting customers with patience, offer support, and allow extra time for processing. For visual, they ask businesses to keep spaces clutter-free, use clear signage and simple colors to reduce distractions. For intentional, they suggest ensuring all communication and setup serve a clear purpose. For create zones, they advise businesses to design spaces that are easy to navigate with quiet areas for retreat. And finally, for environment, they recommend business buildings should aim for neutral, low stimulation spaces with natural ventilation and lighting. To demonstrate their principles, the authors presented an illustration of a cafe with lots of distractions. As you can see on the left, the questionable aspects of design are identified by the exclamation marks. To help make it more autism-friendly by applying the service principles, the cafe business owner should clearly mark the direction that the customer should walk to the counter, as indicated by the green mark on the floor. And they should also indicate where to line up, so by the red 1-2 spots on the ground as well. And then business owners should indicate clearly where to order and also where the toilet are. So provide clear signage. They should also clearly indicate the cost of items and then provide some visual symbols to support communication. Now we'll go through 2 frameworks that focus only on sensory aspects of autism-friendly design. Using a participatory research design, Karen and colleagues conducted a study to examine the sensory experiences of autistic adults in public spaces. Their findings resulted in 6 principles that encompass considerations such as sensory spaces, spatial constraints, predictability, understanding and supporting from others, necessary adjustments, and opportunities for recovery. The British Standards Institution published the Design Standard on Neurodiversity and the Built Environment in 2022, which provides guidance on creating sensory inclusive environments for a range of neurodivergent groups to meet both social and legal obligations. I will now pass it back to Tom for final reflections.
There are such an interesting range of models out there. It's very clear that they all have strengths and there are commonalities across different models. However, from my point of view, I think it's clear that sensory alone is not sufficient. There's so many other barriers in the environment that we also need to address as part of an autism-friendly framework. It's clear also that models evolve from where they were initially based. So some models, if you have an education base and you're thinking about students, you might want safety as a key part of that model, where clearly it's not part of other models perhaps that might have evolved from a supermarket. It seems that this is very much an evolving literature, and it's exciting to see these discussions be had. For me, a consistently applied evidence-based approach will definitely bring benefits to lots of autistic people across Australia. However, what's really interesting, I think, is though there are really good pieces of autism-friendly research, and I've seen this in numbers of areas, including eye care, dentistry, and things like that. No published study has actually used these particular frameworks and evaluated these frameworks. So definitely there's work to be done. Thank you.
Thank you for joining our webinar today. My name is Chris Edwards, and I'm excited to share with you some key insights from our research on exploring autism-friendly initiatives in Australian airports. Before we get into the details, let me give you a quick overview of today's presentation. Just look at some of the background on the experiences of autistic people during air travel, briefly describe some of the autism-friendly initiatives at these two Australian airports. Then we'll move into the study overview and talk about the key findings and wrap up with some concluding thoughts. Let's begin with the background. So, equal access to transportation is a fundamental right as outlined in the United Nations Convention on the Rights of Persons with Disabilities. Yet, despite this mandate, people with disabilities, including autistic people, still face many obstacles when travelling, especially during air travel. For autistic people, air travel can be particularly challenging due to various demands it places on them. And if we break it down from check-in to security to boarding to flight and finally arrival, there are multiple stress points along the way. Some of the most common challenges include queues and waiting, crowded spaces, that overall unpredictability, as well as the overwhelming sensory inputs like noise, light, smells. And then there's difficulty with wayfinding in such a large, complex environment. Not to mention the stringent procedural requirements for security and boarding that only heighten stress levels, all of which can lead to anxiety. These challenges make air travel a daunting experience, and some families even avoid air travel altogether. Some airports around the world have introduced a range of autism-friendly initiatives. It can include sensory rooms, visual stories, preparation videos. One of the most widely adopted initiatives is the Hidden Disability Sunflower Program that over 240 airports worldwide have implemented. And this program, it trains airport staff to be more aware and knowledgeable in providing the necessary support when they see a person wearing the sunflower lanyard, which discreetly signals to staff that they may need additional assistance. Before moving into our research, I just want to briefly describe the autism-friendly initiatives that have been implemented at two major Australian airports, Sydney and Gold Coast. For both airports, the process began with a walkthrough environmental assessment, where autistic staff helped identify those potential sensory challenges and accessibility barriers. These assessments informed a series of key initiatives like the partnering with the Hidden Disability Sunflower Program, if they weren't already, extensive face-to-face training, visual resources, sensory maps, improved wayfinding, assistance lanes for security, and adjustments to the sensory environment. This image is one example of a sensory map available on Sydney Airport's website. The colours immediately capture my attention, with red being those high sensory areas that I would avoid or minimise my time where possible, and green being those low sensory areas, the areas I probably want to spend my time waiting. And in the legend, you can also see icons for sensory input, communicating to people where they will likely experience more smells, more visual stimuli, crowds, and sounds than other areas. Now that we've covered the background and the initiatives implemented, what did we actually do? So we looked to answer the question, how do autistic adults and parents travelling with an autistic child of any age experience travel through these airports? And how can their experience be made better? We interviewed 13 people, 8 autistic adults, and 5 parents. We directed them to the airport's accessibility websites before their travel, asked them to use whatever they thought would be helpful, and then interviewed them after their trip. Now, moving on to the exciting part, our findings. Our analysis identified 3 major themes. Firstly, there is a need for improved accessibility at airports, particularly around that sensory overload, wayfinding and quiet spaces. Theme 2 really centres on that hidden disability sunflower lanyard. And finally, Theme 3 calls for greater awareness within the whole travel and tourism industry. For Theme 1, our first key finding was talking about that need for improved accessibility. And the sub-theme, the first one, talks about that overwhelming sensory input autistic people experience at airports, those bright lights, loud noise, crowded spaces. The second sub-theme underscores the importance of that extensive preparation to minimise that sensory overload and minimise that anxiety. Some people told us how they plan ahead by reviewing accessibility options at airports, but most of our participants didn't know that these resources existed until we actually prompted them to look there before their trip. And one participant expressed this sentiment clearly, where they said, at the moment, it seems to be on the person with a disability finding out what there is for them, rather than saying, this is what we've got for you. And it's just another feeling of like, do I want to travel? Will I feel safe? The third sub-theme talks about the need for dedicated quiet areas in airports. One parent explained how they purposely purchased Qantas Club Lounge 2, which obviously costs us a fair bit of money each year, but we do that to try and get the children out of those high sensory environments. It gives an environment that's a lot quieter and a space where my kids can just sit down and breathe and not have so many, sensory overload things around them. And unfortunately, many autistic adults and parents describe similar experiences, paying to access a quiet area in an airline lounge. The final sub-theme in Theme 1 talked about how the current initiatives at these airports were a good starting point. So they have been helpful, but there is more to be done to better meet the needs of autistic travellers. As one autistic participant put it, it's a lot better than a lot of airports I've experienced, but there's still a long way to go. The second key theme is that those sunflower lanyards are magic when they are recognised. This theme captures how impactful the sunflower lanyard can be when airport staff are aware of its significance and treat people with kindness, understanding and dignity. As one parent shared, staff that saw the lanyard were everything you need as an autistic person and the parent of one. We didn't at any time feel we had to bring attention to needed support. When support was offered, there was not fuss, just kindness and recognition. To be honest, this brought me to tears more than once. It's one of the first times we've travelled and found support offered with dignity. I thanked the staff at the screening and told her I wasn't sure if she knew the difference it would make to his trip. To be able to go quietly through, I don't think I've seen him so happy, feel so accepted for a long time. The second sub-theme here reflects how participants appreciated the visibility of that sunflower logo, particularly at security to avoid the stress and anxiety of the crowd. But some people felt it should be more prominent, especially during boarding. An autistic traveller suggested that there should be a sunflower lane there as well, as it makes it a lot less stressful to use assisted boarding. Autistic adults and parents emphasise the importance of airport staff proactively offering support upon noticing the sunflower lanyard, as they were often reluctant to seek help themselves due to that stress or anxiety, or really just not knowing who to ask. Having staff approach them with assistance provided that reassurance, whereas the absence of proactive support led to people feeling overlooked and unsupported. In the words of one autistic adult, I don't want to have to be like, oh, I'm autistic, please help me. I just don't want to have to put myself in that position. The final theme highlights the need for greater awareness within the whole tourism industry of hidden disabilities. While the sunflower lanyard was predominantly recognised at Sydney and Gold Coast airports, participants reported inconsistent support at other airports and with their airlines. One autistic participant mentioned that at a different Australian airport, the lanyard wasn't recognised unless they were actually accompanied by someone. In another case, a travel agent denied an autistic parent access to discount flights who was travelling with their autistic daughter who required one-on-one support because that's not the kind of disability you've got. It's not a physical disability. Finally, airline staff didn't know how to respond to help a parent with their autistic daughter experiencing anxiety on the flight. They recounted being told, "We don't know what that is. Do you want us to call a doctor?" I was like, oh, never mind. If you have a need, it has to be a medical emergency need. Otherwise, it's not a need. With these findings in mind, let's turn to some of the final thoughts on what they mean for improving accessibility in airports. Our research shows that autism-friendly initiatives at Sydney and Gold Coast airports have fostered more inclusive and dignified travel experiences for autistic travellers. Programs like the Sunflower Lanyard and sensory maps are a step in the right direction, but sensory environments remain a significant challenge. There is an urgent need for more accessible, quiet areas in airports, spaces where travellers can find relief from the overwhelming stimuli. And it's not fair that autistic people and their parents often have to pay considerable money to access the quiet area of an airline lounge. And while resources like sensory maps can be helpful in preparing for a trip, many people seem to be unaware of these tools until they were prompted by the study. And this highlights a gap in communication where airports, the tourism industry, disability service providers need to do more to actively promote these resources to the community. The Hidden Disability Sunflower program was highly praised by our participants, especially at Gold Coast and Sydney Airport, where staff recognition of the lanyard led to those positive and supportive interactions. However, air travel typically involves passing through multiple airports, and that's why this program's limitations become clear. The inconsistency of the Sunflower Lanyard recognition across different airports creates uncertainty for autistic people. There are airports that do not participate in the program or lack sufficient training, and this leaves travellers without the consistent support that they expect and need. And also there is a lack of clarity around how the Sunflower Lanyard can be used. In conclusion, our findings describe how autism-friendly initiatives are making a positive impact on the travel experiences of autistic people. However, as we've seen, sensory overload and inconsistent support remain key challenges that must be addressed for air travel to be more inclusive. For this to happen, we need standardized programs that expand across the entire air travel industry. This not only includes airports, but also airlines and travel agents, ensuring that all personnel are trained and equipped to support travellers with hidden disabilities, regardless of airport or destination. Thank you.
Hello, my name is Aimee Fletcher, and today I'm very excited to share my PhD research, which is at the University of Glasgow, on creating accessible museums and cultural heritage organisations for neurodivergent audiences. So, to give an overview of what I will be talking about today, I will be discussing the research itself, so the research questions and the methodology. I'll then discuss the findings from the neurodivergent and museum worker surveys, and then I will summarise by talking about what this means for the sector. So firstly, the research overview. Early on in the research, I wanted it to be as driven by the priorities of neurodivergent people as possible. So I started with 5 different questions and took them to 2 focus groups of neurodivergent adults to find out what the research should focus on. And that's where these 3 research questions came from. So the first one was focused on what the motivations are for visiting museums, but also the barriers that exist that can negatively impact whether neurodivergent people can visit. I then wanted to find out what it is that museums and cultural heritage organisations currently offer and how confident they feel in what they have available, but then also what the barriers are that impact their ability to be more accessible. Because in the same way that there are barriers that impact neurodivergent people accessing museums, there were also barriers that would impact museums being able to overcome those barriers. And then the third question was about how museums can learn directly from neurodivergent adults and be able to use those learnings to adapt their practice and be more engaging and accessible. So really around the participatory side, the involvement of neurodivergent people directly in developing the resources and events and provisions that they need to visit or work in the space. So in terms of the methodology to answer those questions, the majority of my fieldwork or research took place between May 2022 and November 2023-ish. So that involved the focus groups I've already mentioned, where I was shaping the research with neurodivergent adults. That included the methodology design, the research questions and the surveys. I then used the feedback from neurodivergent adults to develop the surveys, so specifically revisiting questions. I got further feedback from focus group members and other neurodivergent people before launching it in September of 2022. I then used the findings and the feedback from the museum worker, the neurodivergent one, to develop the museum worker one. So I wanted to make sure that I'd learned from things that happened in the first survey, from the feedback that had been gathered, to then develop that. The surveys both closed at the same time in February 2023. In total, there were 600 responses to the neurodivergent survey and about 250 to the museum worker survey. But then when I used the criteria for inclusion, this was then narrowed down to 466 responses for the neurodivergent adult survey and 130 for the museum worker survey. So still a very large number. I then used thematic analysis to go through the qualitative findings from the surveys, and I used Qualtrics to analyse the quantitative findings. And then I held 4 different workshops in total, so 2 at Autistic, a conference specifically for neurodivergent people, and 2 at the Scottish Museum Federation to go through what was found in the surveys, find out if it resonated, what might be missing, any codes that should be refined. And then since then, I have been writing up, and I'm now at the stage of nearly submitting my thesis. And the next step will be developing a sectoral guidance toolkit using those findings from the surveys and workshops, and hopefully some other consultation. To the findings themselves. To give a quick overview, the majority of the neurodivergent respondents preferred identity first language. There was a diverse age range represented, so approximately ages 18 to 73. Gender-wise, there were a majority that identified as being female, and then non-binary, and then male. But again, it was generally a good mix. The biggest gap in terms of representation was to do with ethnicity and to do with regions represented. So whilst the survey was open to anyone who was neurodivergent, could write in English, had visited a museum within the last 5 years, and were aged 18 plus, the majority of respondents were from countries where English language is kind of the main language. So there was some representation beyond that, but it was not as representative as I would want it to be. In terms of the barriers, so this question was quite a big one. I included different options, but then also asked people to give insight to any barriers that weren't listed. So the majority indicated lack of time. However, the second highest was other, and the majority of those responses tended to be related to the sensory environment, so their sensory needs not being met. The next was about the cost of visiting, particularly in relation to anxiety about whether needs would be met. So that was something that made people feel like they couldn't go to a museum because if they went and they didn't enjoy it, they had to spend quite a lot of money to find that out. There then was the lack of events specifically for neurodivergent people, and this feeling of not being comfortable, not feeling welcome, not feeling that your needs would be met. Additionally, there was the lack of information and feeling like it's hard to find the information that you would need. So to do with what resources are available, what events are available, what access considerations that organisation makes. And all of this contributes to anxiety about visiting, about that feeling of not belonging and not feeling safe and not feeling your needs would be met. However, despite those barriers existing, the majority of respondents were very positive in terms of what it is that they liked about museums and why they like to go. And one of those top reasons was to do with an existing interest. So the majority of respondents indicated that they like to go to museums because it was an opportunity to explore interests, whether they are existing or new ones. And it was an environment that they could socialize with others in a way that took the attention away from one-to-one interaction, and it became more focused on sharing the experience of being in a space, looking at objects, of learning together. The majority indicated that they went for leisure reasons or for learning. So some people go to homeschool their children or because they want to learn themselves. This was far more common than people that were going for work or study purposes or just to use the facilities. So it shows that there is a genuine interest in going and being in a museum space when it is accessible to them. And now to think a little bit about the museum worker findings. So again, to give an overview of some of those key findings, whilst the museum workers did not have to identify as being neurodivergent, I did ask the question because I wanted to get an indication of how many people may work in the sector. And of the 130 responses, 37% responded yes to identifying as neurodivergent, and another 9% said that they maybe were neurodivergent. So when you think about that split of being nearly, not quite 50-50, but a high percentage of people indicating that they are or may be neurodivergent versus those that outright said no, it does suggest that there's a high number of neurodivergent people working or wanting to work in the museum sector. Of those that took part, there was a good representation across different types of roles, so from volunteer all the way up to director, with people working in education and special collections, and then also different types of organisation. So not just large museums and small museums, there were also libraries, archives, cultural heritage centres represented. Overall, the participants in this survey had a good understanding of accessibility. In response to the question about what accessibility means to them, there were very similar responses to those that were answered in the neurodivergent adult survey. So again, it shows a shared understanding. However, despite that good understanding of what it means to be accessible, the confidence that most of the respondents had in what was available in their organisation was quite low. And actually, there's a high degree of uncertainty about what was already available, what their organisation was already doing or planning to do to meet access needs. But there was a clear motivation to enhance what is, or perhaps not yet, available. So as mentioned, one of the planned outputs for this research is a guidance toolkit that has been developed using feedback from the neurodivergent adults, but also from museum workers. In terms of making it useful for museum workers, I wanted to find out what it would be that would benefit them. And the majority indicated that they would benefit from having common barriers identified so that they could better understand what needs to meet, advice on how to create resources, so whether it be sensory kits, booklets, anything that is for neurodivergent people. Again, they wanted to find out about accessibility needs, how to plan events, how to involve neurodivergent people in developing resources, and general information that they should know in order to make sure that their staff and themselves have a good understanding of what it means to be neurodivergent. And as the numbers indicate, most people selected multiple categories of information they would benefit from. So it shows that there is that interest in being more accessible. So what do the findings mean for the sector? Overall, the survey shows that neurodivergent people are motivated to visit museums. However, inaccessible environments, lack of information, anxiety related to whether their needs would be met, limit how many people can go. And so if museums and galleries and cultural heritage centres work with neurodivergent people to improve their facilities and their offer, they could benefit not only neurodivergent people as visitors and workers, but other audience groups as well. So in terms of advice for museums, the neurodivergent adults to the survey suggested that information was made available in different formats, so videos, audio tours, booklets. They suggested having sensory environment adjustments, so being able to adjust the volumes and level of exposure to interactives in one space, but also being aware that some neurodivergent people are sensory seeking, so providing options. Ensuring there are facilities available that enable neurodivergent people to access quiet spaces, seating for reflection and decompression, and allow people to bring their own food to meet dietary needs. And then the last one was to do with training and event and resource development. So directly having neurodivergent people involved in delivering training, in developing events specifically for neurodivergent adults, not just events and resources for neurodivergent children. And why focus on accessibility? So this graph shows that at the moment, the respondents to the neurodivergent adult survey go approximately once every couple of months or less on average. However, if museums were more accessible, they would want to visit more like once a month or more often. So it indicates that if museums were to become more accessible, then neurodivergent people would be able to come and visit more. So in terms of conclusions and next steps, museums should be prioritising making their spaces more accessible for neurodivergent visitors, but also their workforce. By working with neurodivergent people directly, they can improve their understanding and make a museum more accessible, and the sector more neuro-affirming. In terms of next steps, the plan is to produce the sectoral guidance toolkit using the insights from neurodivergent adults, both visitors and museum workers. Thank you very much for your time, and I look forward to answering any questions that you may have.
Brilliant. Thank you so much, Aimee. And just wanting to spare a quick thought for all of the presenters who've not only had to watch themselves, but hear themselves talk at themselves for the last hour. It's painful sometimes seeing yourself on screen, but there we go. We have a few questions, I think, which I'll go through, but do keep them coming. Aimee, I have a few questions for you. On the work as well. Any plans that it will be published at some point?
So that is the hope, that is the aim. I just submitted only a couple of weeks ago for the thesis. The plan is to hopefully use some of my research funding that I've got remaining from my PhD to essentially do some co-production or co-design workshops with most likely neurodivergent museum workers to pull together what was found and put together a resource. Yeah, that's the plan. We're just looking at next steps now on how to make it happen.
Yeah, well, fingers crossed. Another question we had was just around the sort of bigger picture barriers in organizations, sometimes funding, sometimes attitudes of the higher up managers. Have you come into contact with any information around those sorts of barriers and enablers?
Yeah, so that was probably one of the biggest barriers, because like asking the neurodivergent adults what the barriers were to visiting, I wanted to know the barriers from the museum workers to making change happen. And it was often around not feeling it was prioritised by decision makers and budget holders, not feeling that they had the knowledge about neurodivergent audiences and the fact that actually the types of projects and investments and accessibility that you put in place for one audience can actually benefit lots of different audiences. So yeah, it was a big issue that came up, and I think contributed to that feeling of low confidence and uncertainty. Yep,
fantastic. And the last question I had was just around special events. Sometimes people have, quiet hours or early birds or things like that. There's mixed perceptions sometimes of those events, and sometimes it feels tick box. It's like that's the only time we can go to the museum, but sometimes it can be a stepping stone as a very first beginning into an environment that enables you to go back more. Do you have sort of feedback from your cohort around the role of special events?
Again, it was mixed. Everyone, like you said, has different opinions on it. Some people said they just wanted to know that it was accessible at any time, that they could access any of these resources, regardless of whether it was 9 a.m. on a Saturday once a month. Of those that did want more events, they wanted it to be more varied in terms of time and in terms of what is going on. So not always being everything turned off. It could be a quieter session where there's only so many people in to help manage those flow issues that can happen in a space, where actually the issue isn't the noise, but it's how many people are around you, the unpredictability, the feeling of being judged. If you create a place that you can just go in and access.
Yeah, fantastic. Thank you. Ru and Chris, I'll bring you in now. There was a super question from Sarah here around how great it seems that co-production with autistic people is very much part of everything that's happening with what we're talking about. How do professionals get input from neurodivergent people who may be nonverbal or face difficulty with self-advocacy?
Looking at you, Ru, that's a difficult question. There's sort of the two prongs there with self-efficacy and non-verbal, but I guess just with just because someone might be non-verbal, it doesn't necessarily mean they don't have anything to contribute. It's about finding the ways that person communicates best and trying to collaborate to get their input. I think, do you have anything further to add, Ru?
I think other than that, I guess from a research perspective, our team, which is led by Vicky, we actually started looking at, from a research perspective, like what are the ways to capture the voices and lived experiences of people who either nonverbal or with intellectual disabilities. So we're starting to kind of learn more and more about what are the approaches we can learn, to obtain that information. And I think once we've learned that, we should be starting to share that with professionals, because I think the approaches should be similar, whether it's everyday life or in research space. But right now, I think we're still learning and trying to find out more about in this space. Yeah.
And I think from a practice point of view, we hear feedback all the time from very diverse groups of people because they've had good or bad experiences at all of these environments. And we learn a lot from practice that potentially, again, can feed into research. There were a couple of questions, I think, around, Matilda had a question around, do the frameworks that people have, are they made available to the public so that people can potentially go and advocate? I thought that was a really interesting question. And the answer, I think, is not really. Mostly this has been our Autism Friendly framework has been an internal device to help us deliver consistent work wherever we go. The challenge, I think, is that many environments are not compelled to do any of this. They do it because they want to do it, I think, much of the time. But I know that advocacy makes a difference because we get lots of leads from people who have complained at places as well. And I think it was interesting, again, that Chris mentioned as part of the research, even the strategies that are available on airport websites often aren't known to people. So there is a lot of communication that I think needs to happen to make more people aware, perhaps about frameworks, but certainly about what good practice looks like in terms of strategies and supports and things like that. We drifted into, I think, some questions around lanyards as well. Autism Friendly is not working with Newcastle Airport. Happy to. As far as I know, we haven't had any contact with them, but we would very much like to. In terms of lanyards, you can get them. Anybody who's signed up to the Hidden Disability Lanyard Scheme should have lanyards available on sites. So there are, I think, 3 places at Sydney Airport at different terminals where you can pick them up. And it's the same at other different airports, train stations. There's a couple across Sydney where you can get lanyards. Or, I think the link was put in the chat as well, you can buy them from the Hidden Disability shop, and that's where you'll get the options like the bag tag and the band and the badge and things like that as well. So they are available. And it's great. Just had a few comments from Di, just saying how it's great to see this is all applicable across so many different settings, and a nod, Aimee, to Scottish Autism and the work that they're doing around communication in terms of decision making. I don't know if you want to add anything before we wrap up, Aimee, around Scottish Autism and work there.
I don't have a lot to add in terms of that, other than I know that Joe Long and the team have been really working on how to make their research and decision making more accessible and inclusive of the people that are in their services, and I believe they have published some papers on it in the past that might be of interest. Yeah,
fantastic, thank you. Well, on that note, if there's no more questions, we'll wrap up the webinar for this evening or this morning. Aimee, thank you so much for everybody for coming along. We really appreciate it. This is one of a series of many research and practice webinars that ARCAP put on. They will continue to happen. I'm looking at Ru and Chris, hoping that that will be the case, but I think the plan is to keep continuing to do the webinars. The passionate aspect is to share research with a broad audience, but really to make sure that it has that practical difference in the real world for autistic people. And I think this is just part of that as well. So thank you so much for coming along. We really appreciate it. Aimee, thank you for joining us. We really appreciate that as well. And good luck with the museums guide and the work that you're doing there in Glasgow. We hope to see it blossom and grow more and more.
Thank you, and thanks for having me today.